Hi, friends. Welcome to Valley Fever Voices. I'm your host, Dr. Pamela Dragos, and today I'm going to break down coughing in dogs with valley fever, why they cough, and more importantly, what you can do about it so that your dog can get some relief and some much needed rest. This is super important because a chronic cough is one of the most common signs in dogs with valley fever. Dogs with valley fever often have a dry, hacking, or honking cough. Dr. Lisa Schubitz is a valley fever expert. She's a veterinarian with the Valley Fever Center for Excellence in Tucson, Arizona, and she was the co-author of a study in 2019 that found that addressing dogs' coughs with supportive treatment, which means cough suppressants, improves patient care. And I think that not only does it help the dog a lot, it also improves the care of the whole family because when a dog with valley fever coughs night and day, nobody gets any sleep. And I just want you to know that you can explore strategies that I use for dogs with valley fever in my online valley fever program at www.rescueyourdogfromvalleyfever.com. So, why do dogs with valley fever cough? First, let's review valley fever. Valley fever is a fungus that grows in the soil, and when the soil dries, the fungal hyphae or strands of cells break apart into tiny individual arthroconidia or arthrospores. When the soil is disturbed by wind or construction, maybe digging, earthquakes even, the fires in California have contributed also. Anything that disrupts the soil. These arthrospores become airborne, and dogs can unknowingly inhale these fungal spores that are contained in the air and the dust. So then in the dog's lungs, the arthrospores morph into spherules that contain endospores and continue to grow until they burst. And this releases more endospores in the lungs that will turn into new spherules, spreading the infection in the lungs. Most dogs with healthy immune systems can eliminate the spherules and endospores at this stage. But some dogs become sick with valley fever because their immune system doesn't kill the spherules or the endospores. And they spread within the lungs and cause a fungal lung infection. So this is when the coughing starts, when the dog's immune system just doesn't act quickly enough and the valley fever spherules and endospores get out of control. The lymph nodes within the chest can become swollen because the body is trying to fight the infection. And sometimes the coughing is caused by pressure of the swollen lymph nodes pressing on the dog's trachea or windpipe and irritating it. If the infection progresses, dogs can develop pneumonia, and this is visible on x-rays. Pneumonia causes more coughing. So that's why your dog is coughing, because the lymph nodes are swollen, pushing on the trachea. There's a lung infection from the valley fever spores that they inhale that turn into spherules containing endospores. And then the endospores spread the infection within the lung, causing a pneumonia. So those are all the reasons your dog may be coughing. So now let's talk about what to do to ease your dog's cough. I took a poll of vets asking what they prescribed for dogs with valley fever. And I did another poll of pet parents with dogs that were suffering with valley fever, asking what their vet prescribed for their dog's cough. So with the poll that I took with vets, and this was actually from a Facebook group entirely for veterinarians that are treating valley fever in dogs or pets, all animals. Half the vets prescribed prednisone, a steroidal anti-inflammatory, for the dog's cough. 25% prescribed cough tabs, which is a combination product of guaifenesin and dextromethorphan. Guaifenesin is an expectorant, and dextromethorphan is a cough suppressant. And then 25% said they prescribed Vicodin or hydrocodone, which is a synthetic opioid derived from codeine. As far as the pet parents, they said that 62% of them said that they received prednisone for their coughing dog, and that sounds pretty accurate. And 26% received Vicodin or hydrocodone. But 12% said that they received Temerol P, which is an antihistamine that is a cough suppressant combined with a little prednisone. But the problem is these pharmaceuticals all have side effects. Prednisone or prednisolone causes adrenal fatigue, delayed wound healing, osteoporosis, bleeding, liver enzyme elevations, vomiting, diarrhea, increased susceptibility to infections, and ulcers. The cough tabs, guaifenesin, can cause sedation and respiratory depression, which can be life-threatening. And dextromethorphan, which is also in the cough tabs, can cause lethargy, retching, vomiting, diarrhea. The hydrocodone or Vicodin can also cause life-threatening respiratory depression and sedation, but also hypothermia, which is a low body temperature, or on the other extreme, hyperthermia, which is a fever. It can also cause vomiting, constipation, urinary retention, which is the inability to completely empty the bladder. And interestingly enough, dogs with the MDR1 mutation are predisposed to the side effects. So dogs that typically have the MDR1 mutation are breeds like Collies, Shelties, Australian Shepherds, Old English Sheepdogs, German Shepherds, and there are others. And then there is the Temerol P. This is an older drug that would seem pretty benign. It's an antihistamine with a little prednisolone, but it can cause sedation, ataxia or a wobbly gait, agitation, seizures, behavioral changes, lack of appetite, a heightened sense of taste, which is interesting. I'm not sure how they know about that in dogs, but apparently they can be sensitive to the things that they're eating. Nausea, vomiting, constipation or diarrhea, dry mouth, pupil dilation, racing heart rate, urinary retention, ileus, which is a lack of intestinal movement or peristalsis, hypersensitivity reactions, dry eye, elevated third eyelids, itching, and bleeding. And Temerol P will also intensify or prolong the action of things like sedatives and anesthetics or pain relievers, some of the pain relievers that are used in combination. So you have to be careful with what you use when a dog is taking the Temerol P. And the other interesting thing about Temerol P is the azole antifungals like fluconazole, and really all the antifungals we're using, or most of the antifungals we're using for dogs with valley fever, will interfere with the metabolism of the antihistamine trimeprazine that's in the Temerol P. And this will cause increased serum levels of the antihistamine, which means they really don't need as much of it or as often to get the same effects, because when they're on fluconazole, the blood levels of the antihistamine are higher. And that's an old drug. Look at what we know now. So then let's talk about some evidence-based non-pharmaceutical cough suppressants. And let me start by saying that evidence in veterinary herbal medicine looks just like evidence in any other field of medicine. You can find evidence-based research on PubMed. In fact, botanical medicine for both people and animals has been extensively studied, and clinical research is being done all the time on all aspects of herbal medicine. The research includes experiments done with cell cultures in basic science labs, as well as meta-analyses on patient care. So as of October 2024, if you were to go to PubMed and type herbal medicine, you would find over 270,000 peer-reviewed publications on herbs. And the really neat thing is, herbs are basically plants, which are food. So the side effects that we would see would be similar to doing maybe a diet change, and really not severe. So there are very few herb drug interactions and herb interactions. One of my favorite cough suppressants, let's get back to coughing dogs. One of my favorite cough suppressants is Ninjom Pepaco. Let me show you this cool. It's also called loquat syrup. It is over 100 years old. It's been around, and it relieves coughs, reduces phlegm, and soothes and protects the throat, the irritated throats. And it has no artificial sweeteners, no chemicals, no additives, no dyes, and it's super safe. Loquat is in the kumquat family, and that's one of its main ingredients. And some of the other ingredients are licorice, which is anti-inflammatory and eases cough spasms. It also supports the immune system and adrenal glands and heals ulcers. And then another ingredient is fritillaria, and that's a flower that reduces inflammation in the airway. And then the base of the cough syrup is honey, which is antimicrobial and coats the inflamed airway or mucous membranes. Another safe cough suppressant that I like is fritillaria and Pinellia, and it comes in a cough syrup or tablets. This is fritillaria and Pinellia cough syrup, but it also comes in tablets, which can be really convenient for some dogs that you can't give cough syrup to, and you have to hide a tablet in their food or something, because you have to be kind of tricky with dogs. Some dogs. But I find that valley fever infections in dogs causes them to have a picky appetite. So you're kind of left with a lot of dancing around trying to get these supplements in them. So we have to find ways to do it, do medication administration efficiently. And it just depends on the dog, really. So the fritillaria and Pinellia cough suppressant is a formula that contains 11 herbs that work safely and synergistically to relieve the cough. It breaks up the phlegm and reduces inflammation in the lungs. And I'll put a link to that one below. You'll find that one in my Valley Fever store because it's prescription, although the Ninjom Pepaco is over the counter, so that's easily obtained. And then there are many other simple ways to relieve your dog's cough. Things like local raw honey, teas, glycerates, essential oils, and other environmental strategies. So you can discover all these easy, natural, safe ways to soothe your dog's cough without risking adverse effects in my online program for pet parents with dogs suffering with valley fever at www.rescueyourdogfromvalleyfever.com. And I'll put that link below as well. So I've put all the strategies I use for my dog patients with valley fever into a step-by-step do-it-yourself program, so your dog can have the best chance of recovery from valley fever. See you next time.